Prevention, our big thing here is immunization rates, and I'm going to look at children and adults. We'll show you their immunizations. So up-to-date immunizations in 19 to 35-month-old children prevent deaths from a lot of diseases. In fact, you can see over on the side the percentage that received their 4-3-1-3-3-1-4 combo. That's how many vaccinations. So they get 4 diphtheria, tetanus, and pertussis vaccinations by that time, 3 polio vaccinations, 1 measles, mumps, and rubella vaccination, 3 Haemophilus influenza type B vaccinations, 3 hepatitis B vaccinations, 1 varicella, and 4 pneumococcal vaccinations. A lot of vaccinations we give our kids, but all of those used to cause tons of deaths out here. And we don't see those anymore, which is so effective. So our rates for that really peaked back in 2010, 2011. We were doing really good. And why did we get so high there, that vaccination rate? We had that Pneumo 13 study that was going on where we were able to initiate the Pneumo 13 vaccine instead of the Pneumo 7. And they went around, they hit every village, and they really got those kids vaccinated. And we did really good. And it prevented some disease even in that short period of time. And we went down a little bit, but we're right about what the Healthy People 2020 goal is about 80%. And we're right at 78% when we measured it. Jane.
The other reason that we've gone down is, if you notice, the varicella. Varicella used to not be part of this series when they looked at on-time immunization rates. That's the chickenpox vaccine. The chickenpox vaccine actually has to be frozen. And so when you give it, and once you reconstitute it, you have to do it within a very small amount of time. And so it's really difficult logistically to get those out there. So the immunization team has been working really hard to increase those numbers and work on that. So you used to never count that as part of the series for on-time immunizations, but they did change that back in 2011. So you're going to see a dip with that. And the team's been working hard to make sure we're getting those supplies to the villages. The issue is we don't have, in a lot of our villages, the appropriate freezer capacity to store those. And if you don't store them, they have to be below 0 degrees Fahrenheit. You can't have a freezer above that, because once you do, it's no longer good. So it has proved to be a logistical challenge for us, but still the staff is doing very well with that.
And this is a great rate. This is something that we got an award for last year. Our rates of vaccinations for kids is phenomenal compared to every other site in Alaska. There's maybe 1 or 2 other places that compete with us on this. And my goal is to eventually blow them away, because we're doing really good. This is something to be very proud of from the YKHC.